So first question, we are asked about syndromes and signs that we can suspect in this clinical case. The first is angina. The second is hypertension. So the signs are typical chest discomfort with sometime deviation of the pain. It happens on effort, so it is stable angina. And rest resolves the pain or discomfort feeling. It is also typical to angina. It is hypertension because of enlargement of blood pressure, both systolic and diastolic. Systolic over 140, diastolic over 90 millimeter hydroargyrum. What are the main risk factors? The main risk factors are the age and the gender of the patient. During the possible interview, we may find other risk factors, for example, heredity, obesity, dyslipidemia, and so on. The investigations to identify the main syndromes we are speaking about are the following. For arterial hypertension, it is monitoring of the blood pressure. It may be done manual or mechanically, better during 24 hours. The condition of target organs investigation for arterial hypertension. The target organs are kidney, heart, brain. According to the heart, it is necessary to fulfill ECG and echocardiography to see the signs of hypertrophy of the myocardium of the left ventricle. For kidneys, it is necessary to see by ultrasound the sizes of the kidneys and the thickness of parenchyma to estimate blood creatinine level, and with its result calculate glomerular filtration rate and estimate the presence of chronic kidney disease or its absence. Fundoscopy will help us to see vessels of the eye, means brain. And albuminuria will show us the condition of kidneys and endothelium dysfunction if it is enlarged. These are target organs for arterial hypertension condition. For angina, ECG will also help us, ECG at rest, to estimate the cardiac rhythm and to see any abnormalities typical for ischemia. For example, inversion of T wave of ST segment. We may perform special ECG at effort. This test will show us presence of ECG signs of ischemia at effort. The same changes in T wave or ST segment. Echocardiography will give us effusion of the left ventricle, diastolic and systolic dysfunction. Lipidogram will show us possible dyslipidemia, and ultrasound of carotid arteries will show us atherosclerotic status with the help of investigation of intima media complex, which must be less than 0.85 millimeters, maybe the presence of atheromas. This is the full answer to the clinical case. Colleagues, do you have any questions? Is it necessary to repeat something? Okay, let's go on. So I shall show you this hour, I shall show you 3 clinical cases. Then we shall have 20-25 minutes break. And after that, we shall try clinical cases. I shall ask you to do it by yourself. I mean, together with me. The second clinical case, please read it. As you remember, colleagues, complete blood count parameters you are to know. That's why there is no identification whether leukocytes are normal or not. The same as for erythrocyte sedimentative rate. Biochemical laboratory test, you aren't know. The only laboratory parameters you are to know are complete blood count and complete urinary test. All other you will be given in blanks as normal or abnormal, or it will be indicated. So, answering to the first question, we can say that the patient has the following syndromes. Infection of HBV. Due to positive DNA, we can estimate this syndrome. Syndrome of liver cytolysis because of enlargement of AST and ALT. Syndrome of cholestasis because of enlargement of GGT and alkylate phosphatase. The level of activity of cytolic syndrome is moderate, the same as for alkylate phosphatase. What are the risk factors? The risk factor is infection of hepatitis B. The main sources are medical procedures, not only connected with blood replacement. It may be blood donation, it may be dental procedures, and so on. And there are other social ways to get this infection. In the plan of additional investigation, yes, and sorry, I did not say about inflammatory syndrome because of enlargement of leukocytes and ERSR. It is inflammation. We are to see the complete blood count because we are interested in presence of anemia, the level of platelets. It is necessary to fulfill more wide chemical blood test to see the level of kidney failure, of kidney function, for example, creatinine, and all other liver parameters as albumin, fibrinogen, and prothrombin. We are also interested in ultrasound investigation of abdomen to see the sizes of liver, the condition of portal vein, the presence or absence of ascites, because we do not know the duration of this hepatitis. And ultrasound, especially its variant, which is named elastography, will help us to estimate the presence of fibrotic changes in the liver or their absence. This is enough for investigation in additional plan. Any other, any questions, colleagues? No? Let's go on. Please read the clinical case number 3. So answering the first question, we must say about angina, effort angina, because it is estimated not only by clinical sciences, but also with additional methods like treadmill test and appearance of depression of ST segment. Moreover, we can speak about heart failure because of low fraction from the left ventricle. You ought to know that normal is 55, not less. And we can suspect previous myocardial infarction because of hypokinesis, or it is only heart failure. We can suspect that the patient may be hypertensive because his systolic level is 140 and diastolic is very close to 90. The risk factors, he is not so old to have real coronary artery disease, but it may start. Only the interview will help us to identify risk factors. And here you are to speak about reversible and unreversible cardiovascular risk factors. Let's revise that. Unreversible are age, gender, and heredity. And reversible are arterial hypertension, dyslipidemia, smoking, hypokinesia, obesity. These are the main, and we can really correct them by treatment. That's why they are named as reversible, and we can control them. The additional investigations that are necessary here is ECG is done are the following: daily monitoring of blood pressure, estimating of the condition and function of target organs for arterial hypertension, chemical blood test of the main parameters and especially lipidogram, ultrasound investigation of carotid arteries, for intima media complex, and the possibility of presence of atheromas. This is the first step of investigations. If nothing is found, or there are some details of atherosclerotic process, we can perform coronarography or angiography, what is better, and especially coronarography, to see the peculiarity of the coronary arteries, and maybe simultaneously treating the patient, for example, by stenting. That is all for the investigation plan. I have enough time, so I can answer your questions if you have them. No? And continue with the fourth clinical case. Please read it. So, answering the first question, these are some syndromes. First is cytolysis because of enlargement of AST and ALT, of moderate activity because the enlargement is in 4 times, and we can suspect cholestatic syndrome because of enlargement of gamma glutamine transpeptidase. Its enlargement of high level is indicated. The patient also has intoxication because of fever. The possible risk factors may be drugs that the patient used during 7 days because of pneumonia. It is necessary to add to the investigation additional plan complete blood count, full biochemical blood test to see the levels of albumin, electrolytes, it is necessary to see common urinary test because the patient has fever. It may be urinary infections also, though it was the course of antibiotics, but it's better to exclude it. Ultrasound investigation of abdomen to see the liver sizes and any peculiarities in abdominal cavity. It's better to perform X-ray of the chest to see the dynamic of pneumonia, to exclude or identify pneumonia complications like abscess because of continued fever. It must be resolved during 7 days of antibiotics and anti-inflammatory drugs. And ECG must be done. Because a prolonged period of intoxication may be associated with electrolytes disorders. Okay, colleagues, now we shall have an interruption for half of an hour. Let's restart at 12:20 using the link for 12:30.
Of blood, hemoptysis. Chest pain while breathing, myalgias, nausea, and diarrhea. X-ray investigation indicates infiltrative changes like focusing in both lungs. Several days ago, her colleagues were hospitalized with the same symptoms.
So, colleagues, now in that exam, please never read the case because everybody has it in front. It is just wasting the time, okay?
Okay.
It is not a mistake. You did not know about it. So it is necessary only to answer the questions.
Okay. I
Mhm.
would say the signs it's the fever
Mhm.
with chills and cough with yellow and streaks of blood,
Mhm.
chest pains, which will lead to some pulmonary problem
You're quite right. Absolutely right. And X-ray helps us.
with infiltration in the lungs.
Yeah.
And the fact
So
that she has colleagues that were with her in the same place and with air conditioner
good.
might suggest that's pneumonia.
Pneumonia, yes, you are quite right. It is pneumonia. Which type of pneumonia, according to the main classification? Is it an outdoors pneumonia or a hospital pneumonia? And if you remember its official determination, please give us.
Community pneumonia.
It's
Community
pneumonia.
acquired pneumonia. You are quite right. It is. So, the second question, how would you answer it?
The risk factors is working in a closed place with air conditioned,
Mm-hmm.
which will cause the infection in general, a lot of people.
Mm-hmm. And the possible contact with the patient who maybe already had this infective process, yes?
Yes.
Such epidemiological peculiarities, which are very typical for pneumonia or any other respiratory diseases. And the main difficult may be the third question, investigations. Let's start with direct examination. What is necessary to do for the doctor?
Auscultation of the lungs.
It's
Good.
sputum test. It's sputum test.
Just a minute. It is also absolutely right answer, but we are speaking about direct examination. What the doctor may do with the hands, auscultation. So
Percussion,
before auscultation, what we perform?
percussion and
Percussion of the chest, you are quite right. It is necessary to look over the patient's body, maybe any skin changes like rash, yes, any bleeding like bruise or something else. Uh, from medical history, are there any information we are interested in? Are there any information we're interested in? Yes, colleagues, about flu maybe some days before, something else. And please think over the investigative plan, additional, I mean instrumental and laboratory. Yes, before instrumental plan, are we interested in any vital parameters, by the way?
Yes, her blood pressure, her oxygen saturation.
Yes, colleagues, just a minute. I need 1 minute for conversation. Да, Ирочка, здравствуйте. Sorry, colleagues, I'm with you again. So you are quite right that vital parameters must be checked. You have started with blood pressure. It is absolutely correct. Why? Because sometimes patients with pneumonia may present as low blood pressure and they are ready to collapse. It may be due to peculiarities inside pneumonia. We are to check it. And as you remember, in CRB scale, by the way, colleagues, is it necessary again to see the scale and to give any comments? Is it? I'm ready if it is necessary. Just to close this
Yes,
question.
please. Yes, please.
Okay, I'll do it. So, according to the CRB scale, maybe I shall find it just now. I try my best. It was the previous class, as I remember. Pneumonia. Pneumonia. I'll find it. It was just a minute, I'll find it. I shall restart with demonstration with pneumonia summary. So when the diagnosis of pneumonia is estimated, have a look, here we are with the scale CRB 65. When a diagnosis of pneumonia is estimated or suspected with a high degree of possibility, we are to estimate the severity of this disease. That's why we need this scale. What does it mean? It means C, confusion, present or not, first of all. Then respiratory rate. If it is more than 30 and more, it is bad. Blood pressure, if systolic is less than 90 or diastolic is less than 60, it is bad. And if age is more than 65 and more. Why is it bad? Because if we have a lot of positive points, for example, 2, 3, or 4, the risk of mortality is rather high. If patient is confused, it means that the level of intoxication is very high. In our clinical case, we have no such identification, so we consider consciousness to be a clean one. If it is a clear, it means that the level of intoxication is not so severe to think about the necessity of hospitalization. If respiratory rate, the second vital parameter which is necessary to identify, is typical to pneumonia of moderate severity, about 22, 24, even 26, but less than 30 in a minute, it is also moderate severity, not high level. And the normal blood pressure, and the patient, as it is in our clinical case, is less than 65, we can constatate that the severity of pneumonia, either a light one or moderate but not severe. Have a look. I suppose our lady has 0 points. She is younger than 65 with normal all main vital signs. So she has low mortality risk and she may be treated at home, for example. We do not discuss the treatment, just for your understanding what is it for. In other cases, have a look, the mortality risk is higher. Even if you compare from 0 to 1 point, it is immediately increased in 8 times. That's why it is necessary to be estimated. Another scale, when only letter U is added, it is urea, may be used at emergency department, for example, at the hospital or in any other medical unit, in comparison with previous one, which may be used at the place where patient is, for example, at patient's home, as it is usual in Russia. CRB at home, CURB at medical unit. The same parameters, but urea is added. Urea, a blood parameter. What is it about? It is about intoxication. Where urea is detoxicated in liver, and intoxication, damaged liver is, as you remember from our gastroenterological block, when the intoxication is severe, we can see liver encephalopathy. So the connection, pathogenetic connection, is clear for you. Urea, before leukocytes enlargement, will show us the degree of intoxication. It's normally used together. Urea, sugar level, complete blood count. That's why we receive all the laboratory tests simultaneously, especially nowadays when some minutes is necessary to fulfill all these laboratory tests. but it is estimated with the help of clinical trials that urea has the main value in the decision about the identification of the severity of pneumonia. Is it clear now, colleagues?
Yes.
Yes? Good. Very nice. And we are coming back. Sorry for once again. Слушаю. Да? Да, здравствуйте. Готовы, готовы, да. Мгм. Да, подъезд единственный. Второй этаж, квартира 13. Прямо сейчас? Хорошо, спасибо, спасибо, да, спасибо. Мгм. So, colleagues, here we are to continue our clinical cases. Here we are. Let's continue. So, vital parameters, as you can see in CRB scale, there is no fever. No fever. It is not so necessary. Sometimes it is really necessary, but not for the severity of the intoxication. Though this level of fever is rather danger, to tell the truth. And it must be monitoring. And very often at this level of fever, some people are unable to look after themselves. That's why they may be hospitalized. Good. We have finished direct investigations. What is about indirect laboratory and instrumental investigations?
Blood tests and sputum tests.
Good. Just a minute. Speaking about blood test, what do you mean concretely? Do you need complete blood count?
No, to yes, to
Yes,
confirm
yes.
infection. Yes, to confirm
Surely
infection.
you
Yes.
need it. Why is it so? Because you will find such information as level of leukocytes and neutrophils. As you remember, bacterial pneumonias are associated with left deviation of white blood cells and prevalence of neutrophils, and even sometimes small amount of very young forms of neutrophils may appear. They indicate the level of intoxication. And we shall treat the patient. So we need monitoring the activity of inflammation. And erythrocyte speed sedimentation will also help us in this case. Then, speaking about blood test, you mean chemical blood test, yes? Which parameters we are interested in? Colleagues, it is important. Why? Because laboratory must work only according to your necessity. And is it necessary to fulfill 50 biochemical laboratory parameters in the blood test in this case? No. What are we interested in? We do not know the age of the patient, by the way. Let it be moderate because she is a working lady. So, what are we interested in? Just let's name the parameters. Albumin. Are we interested in? Gabriel, are we interested in albumin and total protein?
Mm,
Yes, yes, sure, because we shall treat with drugs, with antibiotics. We need
chest function.
something to care. Transport albumin will care our treatment drugs and solutions, so we need it without any doubts. Moreover, uh, are we interested in liver and kidney function of our patient? Because if they are damaged, their failure, liver or kidney, will influence on the duration of pneumonia as we understand it properly. So From this point of view, we are interested in albumin and total protein. You see? Well, are we interested in the level of creatinine? Yes, sure. Are we interested in the level of sugar? Maybe the lady has hidden diabetes or something else, so it must be done. Are we interested, for example, in lipidogram? No. Uh, Maybe it will be checked during her annual medical check, but not now, for example. And speaking about coagulation, to which we have dedicated the whole hour today, we are interested. Why? Because any inflammation is associated with peculiarities or disturbances of coagulation to both sides. It depends upon the peculiarity of the patient. It may be either bleeding or clotting formation. That's why we are interested in coagulative test. Moreover, fibrinogen is an independent factor which identify any inflammation. And the marker of pneumonia is C-reactive protein. To tell the truth, it is an immunological blood test, but still it must be done. And what is about electrolytes? Are we interested in the level of potassium, sodium, calcium? Sure we are. So, especially the patient has nausea and diarrhea. Do you remember I have shown you the ECG with low level of potassium in blood? Yes, and corresponding low level inside cardiomyocytes. Yes, so all these parameters we are interested in. AST, ALT, gamma GT also. Let's make a summary of the chemical blood parameters once again to make it the full list. So albumin, total protein, glucose, creatinine, liver enzymes, and bilirubin may be also included, and electrolytes like potassium, sodium, calcium. These are parameters we are interested in from blood biochemical test. Gabriel, please continue. What other laboratory tests is necessary to be done?
Sputum test, maybe?
You are quite right, but we have some of them, or which we are interested in. Common sputum test, without any doubt, to see the elements of inflammation. Moreover, red streaks in the sputum. So it is the corresponding stage, morphological corresponding stage of pneumonia. And we shall monitoring it with the help of common sputum test and culture sputum test. Yes, what is it for to perform culture sputum test?
To know which antibiotic would better suit for the treatment?
You're quite right. Just to name the microorganisms which are responsible for this pneumonia. It may be a single one, any cock, for example, pneumococcus, streptococcus, staphylococcus, or something else, atypical bacteria like Legionella, especially concerning the conditioners, and it may be viruses, it may be fungi. So we are to know the microorganism, one or a group of them, which are responsible for the pneumonia and their sensitivity to antimicrobial agents for the treatment. Do we need any other investigations, instrumental, for example?
I think it would be enough.
ECG. ECG because the level of intoxication is rather high, for example, the temperature. So we ought to know, colleagues, 1 minute, okay? I'll be back. Sorry for interruption. Here I am back with you. So ECG is also necessary for us. Okay, thank you very much to our two colleagues who take the best attempt, because it was the first one, in the solving of this clinical case. Let's go on. The seventh clinical case. Just read it. We have only 5 minutes, but we can start answering. So, who is ready?
Me, Professor.
Please, you're welcome. The same student, yes. What is your first name?
Nur.
Please try your best.
It could be proteinuria, macro.
Yeah, quite right. Proteinuria, yes.
Macrohematuria.
Very nice. How will you name this one? It is uremia. Uremia. Yes, because creatinine in blood is enlarged. Or just name it like this. And hypercreatininemia. It is. So, what other signs can you identify? How would you name this one?
Increased blood pressure. Increased blood pressure.
Hypertension.
Yes,
Hypertension, yes. How would you name this one?
Tachycardia.
Tachycardia, yes. Maybe from the first point of view, it is very simple. Colleagues, you will show your knowledges, you see? And if we collect all these sciences together, which syndrome can you identify from hematuria, edema, proteinuria? By the way, it is necessary to add with not nephrotic level.
It could be glomerulonephritis.
It is a disease. It is a disease. And you're quite right. It may be glomerulonephritis. But it is necessary to identify the syndrome, the nephrological syndrome. Have a look. Proteinuria. Yes, yes. Which one?
Nephritic syndrome. Nephritic syndrome.
It is not nephrotic. Be attentive.
Nephritic.
It is very
nephritic.
Yes, you are quite
nephritic.
right. Colleagues, nephritic, not nephrotic. Nephritic. Only one letter is changed. but the sense is another one. Why? We have all components of it. Proteinuria with edema, with hematuria, doesn't matter macro or micro. Here we have macrohematuria, we can see it. Enlarged creatinine in blood and enlarged blood pressure. All the components of nephritic syndrome are present. That's why it is nephritic syndrome. You are quite right, absolutely quite right. Okay, colleagues, not to waste time, let's restart simultaneously, okay? Just now I shall finish the demonstration and then please restart. Statistically, simultaneously identify as a correct nephritic syndrome. Thank you very much, my darling students. And now we are asked about risk factors. Can we notice any risk factors in the clinical case? No, no, they are not identified. In this case, just answer as it can be usually. What are the main risk factors of glomerulonephritis?
It could be infection before.
You are quite right. Which one? Which is the main popular infection for glomerulonephritis?
Streptococcus.
Yes, streptococcus, hemolytic A group streptococcus. What are possible other risk factors? Neoplastic process may be associated with glomerulonephritis. Drugs, sometimes also.
Diabetes.
Okay, pardon? Pardon?
Cancer.
Diabetes, you are quite right. Yes, you are quite right. Systemic diseases, systemic connective tissue diseases. Okay. What can we speak about additional investigations? Is it necessary to investigate anything direct or all is done? Maybe vital parameters. They are always necessary, and you will show your knowledges, you see. Vital parameters, including BMI, by the way, because we shall monitoring the weight of the patient, which is
Anti-erythrolysin antibodies.
we are speaking about direct now, and then you are quite right, additional laboratory tests. So after vital parameters and all systems investigation, we shall create the plan of additional investigations, laboratory and instrument. One of the main you consider to be anti-streptococcus antibodies to estimate the possible etiology of the process, and you're quite right. But let's begin from the beginning. Do we need a complete blood count?
Yeah. Yes.
Yes. Which parameters will help us and for what? What is about red portion?
ESR.
Yes, and ESR will show us the intensity of inflammation, and anemia may be especially because of hematuria. Yes, losing erythrocytes, we can receive anemia. Uh, from one hand because of bleeding, from other hand because of intoxication. If you remember, severe intoxication, chronic intoxication may have a result as anemia. Here, I suppose we have an acute situation and anemia due to bleeding may be. What other parameters we are interested in complete blood count? By the way, it is a current infection, which will be identified with neutrophils evaluation. If the level of neutrophils is increased, it is according to the possible infection. Do we need common urine test?
Yes. Yes.
Sure, you're quite
Yes.
right. There are some parameters from it, but it's necessary to see if it is possible, neutrophils, so leukocytes, and divide them to neutrophils and lymphocytes to identify the local process, inflammative process. It may be either bacterial or immunological. In case of bacterial source of inflammation, neutrophils will be. In case of immunological, lymphocytes will be. So even common urine test will help us for identification. What other urine tests are necessary to be done?
Also, we need to check glomerular filtration rate.
Yes, but we shall do it with the help of creatinine from blood chemical test. Let's finish with urine. We had a previous test with daily proteinuria. So each day or in a day, it is better to check the dynamic of proteinuria. So we need daily amount of urine and daily amount of proteinuria there. Good. So we has come to chemical blood test from which we are interested to see dynamic of albumin. It was normal. Creatinine, which is enlarged, then cholesterol, total cholesterol, to be sure we are not close to nephrotic syndrome. Together with nephritic, sometimes they may be together in progression. We need sugar level, because we shall treat the patient very often with drugs which influence on sugar level, and any inflammation may be associated with bad sugar level. And also, it is necessary to see the level of electrolytes such as potassium, sodium, calcium. Good. You are quite right. It is necessary to calculate GFR, glomerular filtrative rate. To remember which parameters do we need to calculate it electronically? What do we need?
Age,
Age,
maybe
gender,
creatinine level.
gender, and creatinine level without mixing the units. Let it be a gentleman. Colleagues, try, just open the calculators and try to do it. I shall do it together with you. I have it in my phone. I put the patient's age, gender, creatinine, and do not forget to use the corresponding units. Here we have milligrams per deciliter. I have 53 milliliters per minute, which is corresponding to the third A stage of chronic kidney disease if it is not an acute situation. Here we understand that it is a little bit decreased, but it is an acute situation. That's why we won't speak about chronic kidney disease. It is necessary to have 3 tests of creatinine during some period. This is done just for necessity of use drugs. All drugs may be used according to this level of GFR. So the investigation, the laboratory part of investigation may be finished, or we need something to continue. To tell the truth, here in any glomerulonephritis with acute and so intensive syndrome, we need coagulative parameters. So coagulogram must be done also, or hemostasiogram. Are we interested in any instrumental methods of investigation? Sure.
Need to
Yes.
swab test. We need to swab test to check for active infection.
You're quite right, maybe. What else?
Mm.
I'm speaking about ultrasound investigation of the kidneys. It will show us sizes of the kidneys, the thickness of parenchyma, the presence or absence, for example, of urolithiasis, the presence and absence of cysts of kidneys. So it will help us to see the kidney structure, not in details. We can't see cells, but we can see the main structures of the kidneys. And the thickness of parenchyma. Parenchyma is the layer where nephrons are. So we shall see that the process is an acute. If it is less than 16 millimeters, we can consider it to be a chronic kidney disease. So ultrasound will help us without any doubts. Do we need monitoring of blood pressure? Only in future if it is not good. Manual monitoring of blood pressure is necessary without any doubts, because we shall treat this condition. It can't be so. Good. And ECG to catch possible electrolytes disorders as soon as it's necessary to do. So the 7th clinical case is also done in a good style. Thank you very much. You did it fantastically normal. Let's see a next one, case number 8. Just read it, and I would like somebody to answer, to give comments. So, who will give answers? Mary, yes, you are welcome.
I would say he has hepatocytolysis according to the increased AST/ALT by 4 times. The signs are like increased blood AST, ALT, GGT, and pain in nausea during the night. Also, the risk factor that he smokes and he takes alcohol 2 times a week.
Gabriel, you are quite right. Just a minute. You are already at and the second question is answering. And what is about the first one? You have mentioned one syndrome. It is cytolysis, liver cytolysis syndrome of moderate activity. You are quite right, according to the level of enlargement of transaminases. And what is about epigastric pain? And have a look. We have a positive occult stool test. Blood occult stool test. What is it about? What can we suspect? And how can we name this syndrome? Gastrointestinal?
Gastric ulcer.
It is bleeding, gastrointestinal bleeding. And if the patient has epigastric pain and we have bleeding, what does it mean? Blood occult stool test. That feces are black, or maybe blood is so hidden that feces are just dark. But according to laboratory investigations, we can see blood erythrocytes there. Where are they from? Where? There are some possible causes. First is ulcer. Second is neoplastic process. Third is immunological inflammation in intestine or in colon, like Crohn's disease and ulcerative colitis. So there are some other surgical problems, but we are in the internal diseases. That's why these three are the main. Neoplastic process may be, but it is more to other possible problems. So strong alcohol, but in a small amount. Still, what it may be. Very often it is ulcer. Yes, ulcer. So thinking about ulcer and having positive blood occult stool test, let's think. Yes, the name of the syndrome is gastrointestinal bleeding. Thinking about ulcer, what methods are necessary to fulfill? How can we
For
verify?
investigation,
Yes, upper endoscopy. First upper and then lower endoscopy, esophageal gastroduodenoscopy and colonoscopy. In case of this positive test, it is very often upper gastrointestinal bleeding from stomach and from intestine. From intestine, we can see duodenal part. Yes, it is possible with the help of upper endoscopy, or special capsule may be swallowed by a patient and we can see the whole gastrointestinal tract. Here it is, I suppose, enough to start with upper endoscopy. And what is necessary to perform together with upper endoscopy? What is the main cause of ulcers? Helicobacter. So, Helicobacter test must be done. When endoscope is out, or we can use this the mucus from in endoscope and perform a test to identify the presence or absence of Helicobacter. Is it clear, colleagues? Or any other tests for identification of Helicobacter? We have revised this material, yes? So you remember, I suppose. Do we need any other tests according to the verified liver syndrome? Or you may be asked, does this patient have any signs of liver insufficiency? And you will answer no, because albumin,
prothrombin are normal.
yes, are normal. So we, at this moment, we do not see any signs of liver insufficiency. Good. And what can we, how can we speak about complete blood count? Do we need it? Yes. Do we have a bleeding?
Yes,
We
might
have.
have anemia.
Yes. Yes, you're quite right. And it is necessary to see the level of platelets, as you remember. Also, Okay. But what is the possible risk factor for such two main syndromes? Two severe gastrointestinal syndromes. What are the main risk factors? Helicobacter for ulcer was named, yes. And what about liver?
The alcohol intake.
It is not so severe. Have a look. 2 times a week, about 50 milliliters. It is small amount.
Mm.
It is absolutely possible for common population. Individually, it may be, and we do not know his medical history. Maybe he's an alcoholic in his past, and it is a chronic disease. So maybe it is amount which is also not suitable to him. So yes, alcohol may be, but not on the first place. But to tell the truth, it is necessary to verify the absence of B and C viruses, hepatitis viruses, by the way. Moreover, the GGT enlargement is so severe that it is necessary to see other components of possible cholestatic syndrome. To remember which other parameters from chemical blood test will help us to identify the presence or the absence of cholestatic syndrome, syndrome of cholestasis. What are they? Except GGT. They are alkylate phosphatase and bilirubin. Yes, you are quite right. You are quite right. So these parameters must be added without any doubts to the blood chemical test. By the way, colleagues, let's identify the main chemical blood test parameters which are always necessary to check. Just write them down. They are prothrombin, total protein, albumin, glucose, creatinine, urea from time to time. It depends upon the situation. AST, ALT, GGT, or gamma glutamine transpeptidase. You can see it, GGT. Alkaline phosphatase, also from time to time, if GGT is enlarged or bilirubin are enlarged. Bilirubin in all fractions, total, direct, indirect. Electrolytes like potassium, sodium, and calcium. These are the main from the chemical blood test. Very often we add C-reactive protein and not full hemostasiogram, but prothrombin. Владимир Владимирович, я занимаюсь до 14 часов. Ну, отвяньте ради бога, hemostasiogram, not full, but prothrombin and fibrinogen. Very often we need these two parameters. From the video blog, you understand why do we need them. As you can remember, it is common coagulative pathway or Sometimes we need the full hemostaziogram. Okay, colleagues, thank you. This clinical case is also well done. And we have two more clinical cases. So maybe some other students wants to give answers, to give comments, please. Nothing is new. We're just training and repeating.
The sciences are edema,
Good.
proteinuria,
Mm-hmm.
albuminuria, or
No. No
no,
albumin.
yeah.
Albumin is normal in blood. Camila, look
Yeah.
attentively. And what is the level of proteinuria? Is it nephrotic or not nephrotic level?
It's non-nephrotic.
Yes, you are quite right. Macrohematuria you have mentioned, and hypercreatinine.
Hypercreatinine.
EMEA, yes. Also,
Hypertension
and
and tachycardia.
you are quite right. All the sciences are named correct. Now, let's combine them to a syndrome. What syndrome we can?
It's nephritic syndrome.
You are quite right. It is nephritic syndrome because all the components of it are present here. Edema, proteinuria of non-nephrotic level, hematuria, and hypercreatininemia together with hypertension. Very good. Let's repeat. What are the main risk factors for this condition?
It could be infection.
Good.
Also,
Neoplastic problems and systemic connective tissue diseases, maybe. Good. What investigations are necessary? Do we need any vital parameters here?
Yes. Monitoring
Good.
of blood pressure.
Mm-hmm.
Also heart rate.
Mm-hmm.
Uh,
Consciousness, it also may be damaged because a lot of dust in the blood. Not so much, but still, we are to monitoring the level of consciousness, yes? And BMI also must be monitoring. Please remember, colleagues, when we have edema, it's better to monitoring weight and BMI. Why? Because plus 1 kilogram means plus 1 liter. It is not so typical for nephritic syndrome. It's more typical for nephrotic, for ascites in liver diseases, but still it may be. Good, Camila. And what other instrumental and laboratory tests must be done?
complete blood count.
Blood count. Good. What else?
Urine test.
Common urine test, yes. What else? From chemical blood count, what do we need?
Chemical blood count.
Chemical blood test. Some parameters are named already, albumin and creatinine. Do we need glucose level here? Sure we do.
Yes.
Yes. Do we need electrolytes?
Yes.
Sure. Are we interested in liver condition? We shall treat the patient. Yes, we need just common like AST, ALT, and GGT. We need them without any doubts. Yes. Is it necessary to see possible antibodies for streptococcus to identify. Yes, we are interested in this. About instrumental investigations, what are the main we need here?
The main investigation would be
Yes,
fundoscopy.
fundoscopy because of high blood pressure in such age. You are quite right. And ECG, yes, to see whether it is secondary. By the way, it will be the secondary hypertension most cases, in most cases, because of the age of the patient. But it may be an essential one, a primarily also. So we are to check the condition of other target organs. That's why ECG, not only for electrolytes, but for hypertrophy of the left ventricle. And concerning kidneys, do we need ultrasound?
Yes.
Yes, we need ultrasound also. Thank you, Camilla, very much. Very well done. And the last clinical case for today, have a look. The material we have discussed at our practical class about lungs. Let's see the clinical text, the text of the clinical case. And let's try to give answers. So who is ready to give answers and comments? Colleagues, if it is difficult, I'll do it by myself and show you all the details, but maybe you will try, some of you. Okay, let me help you. So, a moderate age person has the following signs: chronic cough, fever from time to time, that's why it is intermittent, with night sweats. Moreover, we can find the sound like a box, so it is a lot of excess air in lungs. It may be emphysema, prolonged expiration, and a lot of dry rails, which are together concerning broncho obstruction. So we can see chronic bronchial inflammation or alveolar inflammation and broncho obstruction. According to the oxygenation, we can speak about respiratory failure together with respiratory rate. It is more over that normal position. So together they give us enough sciences to estimate respiratory failure. We do not know if it is acute or chronic. We do not know what was previously with the heart rate, respiratory rate, and the oxygenation. But now it is respiratory failure. Moreover, he is tachycardic and hypertensive. So this patient has hypertension, respiratory failure, bronchoobstructive syndrome, and inflammation on the territory either of bronchus or alveolus. More variants for bronchus because auscultation gives us only dry rails. If there are moist trails, it is maybe alveolus. More often, crepitation shows us involvement of alveolus. That's why risk factors are the main smoking. He has occupational risk factor because he is on the road with not fresh air. I suspect smoking because he has a chronic cough, or it may be only occupational risk factors. In this case, I need a common X-ray of the chest, spirogram with broncholytic tests, complete blood count, common sputum test. In case of verification of any bacteria, culture test. And this is the full first step investigation. Only I would like to add the interview with the patient for verification of his smoking status and previous episodes of flu and the onset of chronic cough, the duration of this disorder. The episodes of pneumonia in his medical history, and the episodes of enlargement of blood pressure. According to the enlarged blood pressure, I need the investigative plan we have discussed about hypertension, target organs. Okay, colleagues, this is the whole material I have prepared for you for today. I have no time for AV block discussion. I shall do it tomorrow with you. So each Thursday class, we shall try clinical cases. I shall make them more suitable for you and send together with all today's material.